is CGTN, China Global Television Network.
Hello, welcome to this special coverage on CGTN. Saturday, April the 4th, marks Qingming Festival or Tomb Sweeping Day in China, an occasion meant to commemorate and pay respect to those who have passed away. During the COVID-19 outbreak, the Chinese people have made collective efforts to fight the pandemic. Many have lost their lives in this cause. A national memorial will be held soon in China to commemorate the victims of the coronavirus and those who lost their lives while trying to help others. This marks the first nationwide mourning for a public health emergency and the fourth such event since the founding of the People's Republic of China. The outbreak began in China in the central city of Wuhan, which has also become the worst hit in the country. It has been on lockdown since late January. Medical staff have been fighting on the front line. Several thousand people lost their lives. A memorial will soon be held there as well. For more on the situation there, let's cross live to our reporter Xu Mengqi in the central Chinese city of Wuhan. Hello, Mengqi. Give us a sense of the atmosphere around you.
Well, Pandun, yes, that's right. A memorial dedicated to those who lost their lives to the COVID-19 here in Wuhan is about to kick off. And the atmosphere here on the ground is one imbued with solemnness. We're now at a square by the side of the Yangtze River, a mother river to the people of Wuhan and China. And you can see attendants have already taken their place waiting for the ceremony to start. Among these people are family members of those who died, including relatives of martyrs who have lost their lives fighting the epidemic at their posts. There are also different groups representing different groups. There are also representatives of different citizen groups in the city, members of the police, of medical professionals, of volunteers, of community workers, and of course also of government officials. Now, the national flag, as you can see, is already flying at half-mast, and later at 10 a.m., which is in about 10 minutes, people will all be paying a 3-minute silent tribute. Air raid sirens and horns of automobiles, of ships, of trains will all be heard across the city. Now, Pandan, you were saying that this is a special Qingming festival for the Chinese because of the epidemic. But actually we know it's been a difficult time for people around the world, especially for those who lost their loved ones because of the contagious nature of the virus, of the coronavirus. Funeral traditions around the world have been cut short or abandoned. Today, however, on Qingming Festival here in China, the national mourning is finally giving people a chance to mourn their losses and to honor the dead. And especially, in Wuhan, because of the over 2 months of a lockdown, there's been a emotional backlog of stress and of grief. So today, really, it is finally a chance for those emotions to surface and for people to mourn their losses. Pandong.
Thank you very much. Our reporter Xu Mengqi in Wuhan. The COVID-19 outbreak has been largely controlled in China at this moment, but this came after a tough and determined battle. Let's take a look back.
In order to bring the COVID-19 outbreak under control, China opted for an aggressive and rigorous response combined with innovation.
All you need to do is to be confident. We will win this war against the epidemic. Wuhan will win, Hubei will win, China will win as well.
In Wuhan, the epicenter of the outbreak, workers toiled day and night to build Huochenshan and Leishanshan hospitals in a matter of days. Over a dozen public venues were converted to temporary hospitals, providing over 12,000 beds. Tens of thousands of medical staff from across the country went to Wuhan, also taking their much-needed medical supplies. A domestic travel ban was imposed. Trains didn't stop in Wuhan during the height of the outbreak. With Wuhan under lockdown, other places in the country also used all resources available to prevent and control the spread of COVID-19. Technology was used to track all the 80,000 plus cases. The travel history and health status of anyone across the nation could be tracked and monitored.
So what China are trying to do is, while they're getting success in putting out one fire, they don't want the fire to start somewhere else. So they're taking very directed measures to ensure that people returning to the city are observed and monitored.
With record-setting speed, China commenced a phase 1 clinical trial for a COVID-19 vaccine, with all volunteers getting a shot. Nothing was easy during the process, and China has paid a high price to win the months-long battle. A former senior executive with the International Monetary Fund says it may have cost China as much as around $200 billion in the first 2 months of 2020. And the most heartbreaking of all, the invaluable lives that were lost, including those who sacrificed to help contain the pandemic.
COVID-19 is reminding us how vulnerable we are, how connected we are, and how dependent we are on each other.
Hard times give everyone a chance to reflect on what life is all about. It could be love, sharing, and unity.
Still in Wuhan, critical care nurses have used life-sustaining technology to treat severely ill patients of COVID-19. They make up the majority of the medical profession from across the country dispatched to Hubei province. Tang Bo followed a head nurse from Beijing.
Because of lengthy intubation procedures and other factors, many patients in intensive care units have delirium and other psychological problems.
大家好，我是北京协和医院内科 ICU 夏莹，我是北京协和医院第一批援鄂医疗队队员。武汉加油，中国加油！
Xia Ying starts her day helping a patient with his physical exercise. After 2 weeks of treatment, the one severely ill patient has regained consciousness and is able to move.
Stays in intensive care units are usually accompanied by muscle weakness. Therefore, interventions that reduce muscle weakness and improve recovery after critical illness are needed. Early mobilization is a complex intervention that requires careful patient assessment and management, as well as interdisciplinary team cooperation.
The intensive care unit nurses give full attention to not only the physical, but also the psychological conditions of their patients.
You saw the patient wanted everyone to leave and got annoyed when other medics touched her. She only talked to our nurse Li Binbin. That shows our nurses have done their best to communicate with their patients, and the patients know it.
Xia Ying says all nurses from the medical team talk to their patients when treating them, including those who have been sedated. They might not be able to hear, but Xia believes they can still feel it. Another job for Xia is to ensure the medical team remains free from infection.
Sometimes I have to slow them down. They're too energetic, so much so that they become less careful in infection control. So I tell them to stay calm and do things slowly and protect themselves carefully.
On this day, Xia Ying checks on a critically ill patient with some doctors. Unfortunately, the patient passed away soon after we left ICU. But hopes remain for others.
We know sometimes we're helpless facing COVID-19, but we've done our best and we're very happy to see patients are getting better.
Tang Bo, CGTN, Wuhan, Hubei Province.
Besides medical workers, another group of people has been critical in fighting against the outbreak. Tens of thousands of volunteers have been mobilized in Wuhan city. Liu Xinqing reports.
Young, energetic, and full of love. This group of people are called ferrymen of the city. Wu Yang is a member of the Epidemic Resistance Volunteer Alliance. an organization that has been providing service for the city since the coronavirus outbreak.
Transportation was disrupted after the city was locked down because a lot of delivery men are from other places who went home for the Chinese New Year, so volunteers were badly needed.
With at least 9 million people still living in the city of Wuhan and forced to stay indoors every day, ensuring daily supply has become a major challenge. Wuhan joined the alliance in January, 2 days after the city of Wuhan was locked down. When the city government decided to recruit more volunteers to meet surging demand, more than 10,000 people in Wuhan signed up for it on the first day. In a city with more than 49,000 confirmed cases, serving as a volunteer is also a risky job. Last month, one volunteer passed away after contracting the disease at work.
Coronavirus is really scary. To be honest, all of us are worried. But there's so much work to be done. If we don't take the risk, it's impossible to get these supplies to the hospitals or medical teams.
After finishing a long day of work, we followed Wu Yang back home. Wu Yang's mother has been closely watching coronavirus developments. For her, allowing Wu Yang to take the risk of serving as a volunteer is a difficult decision to make.
I didn't agree when she first told me she wanted to be a volunteer because I worried about the kids' safety. But she insisted, so I separated her from them. The kids would rush to her every time she came back, but she would warn them to stay at a safe distance.
After more than 1 month of hard work and dedication, Wu Yang has convinced her mother and turned her into a strong supporter of her volunteer work.
The city has gone through a lot. Now I fully support what she is doing.
Like many others, Wu Yang says she's proud of what she's doing, and she feels encouraged that she's not alone. Wu Yang says they'll never stop fighting until the virus is defeated. Liu Xinqing, CGTN, Wuhan, Hubei Province.
Despite gaining the upper hand themselves in the battle against the COVID-19 outbreak, families of those who lost loved ones to the virus continue to grieve. Zhao Yunfei introduces us to a family still coming to terms with the loss of a loving mother and grandmother.
The day Liu Zeqiong's mother passed away from COVID-19 infection, her 8-year-old daughter drew a picture of grandma. Liu says she's not yet ready to explain what has happened.
The day she knew grandma had died, she cried. I hugged her.
Bed number 6 is where grandma was kept in the ICU before losing her battle with COVID-19. Liu says her daughter's picture relieved her, as she was not allowed to see her mother due to her deteriorating condition. Liu called the hospital every day and searched online for reports of her mom's ICU ward.
It feels so unreal. I was told she passed away, but now I can't get her remains. We are under quarantine. It is indeed unrealistic. Her pictures are still fresh in my mind.
Liu's mother was an active member in the community. Neighbors say she was well-liked and had great personality. Liu's husband is now taking on more responsibility with his mother-in-law gone.
I had a good relationship with my mother-in-law. She was just like my mother. When she was here, the family atmosphere was so great. Her death is a huge loss for our family.
The couple says the epidemic has made them realize the importance of family, and the tragedy will keep them more united and strong. Zhao Yunfei, CGTN, Wuhan, Hubei Province.
Saturday, April the 4th, marks the Qingming Festival, or Tomb Sweeping Day in China, when people pay respect to their departed loved ones. And in order to mourn and remember the martyrs in the fight against the COVID-19 and victims of the virus, China will soon hold a national memorial for those passed away during the outbreak. There was a national memorial for the people who lost their lives in COVID-19 outbreak in China. Chinese President Xi Jinping and China's top leadership, along with all the people in China, have observed 3 minutes silence tribute to the martyrs who lost their lives fighting the outbreak and the victims of the virus. For more insight into that, we're joined in the studio by Professor Hu Naijun from the University of Chinese Academy of Sciences. Well, Professor, this is the first time China has held a national memorial for a public health emergency. What's the significance of this very event?
Yes, we have to say the martyrs the martyrs, heroes, the victims of the coronavirus needs to be cherished because of their sacrifices. We can achieve some kinds of progress in the battle against coronavirus, and we also accumulate some kinds of experiences in fighting against the coronavirus. These are all the cost of their sacrifices, and we must cherish them. And this kind of sacrifices and efforts are not only for our Chinese people. Right now, we can see these valuable experiences and gatherings are also useful to other people in other countries. So I should say, not only Chinese people, we are in memory of them. Also, the world people should pay some tribute to our martyrs and heroes.
So right now, the outbreak in China is largely under control, but the fight against this pandemic is far from over. What are the major challenges faced by China in the coming days?
From the number of the newly confirmed cases domestically, we can say we have achieved a lot because the newly confirmed cases in every day is only several. As far as I know, the Beijing's case is only 1 point case yesterday, and it is an imported case. So from domestic point of view, we have achieved a lot, but we have to say that other countries have to see some kind of major spreading of this kind of coronavirus. So we still have to be cautious. Even from domestic points of view, we shouldn't say we have achieved a complete victory, because the newly confirmed case is not zero. Even if the newly confirmed case is zero, we still have to take the incubation period into consideration, because the zero newly confirmed cases has to last at least 2 incubation periods to say we have a final victory. That is 28 days. So I think we have achieved a lot, but it's still too early to say we have the final and the complete victory. We still have to be cautious on our border control and our community and for ourselves.
Indeed. And talking about what China has done right so far, how would you characterize those achievements you just mentioned? Would you say it's a combination of strong governance and collective efforts?
Yes, we do have so many things to summarize as our experiences. But I think 3 points that I want to make today. The first one is the strong social mobility capacity of our central government. As we all know that Hubei province or Wuhan city alone cannot fight against this coronavirus all by itself. We need to concentrate all the resources nationwide. For example, the human resources, the medical staffs, even money from other regions to fight against the coronavirus. So under the leadership and the social mobility capacity of our central government, we have achieved this. Our central government has a strong leadership. But at the second point, I want to say that there is a still strong grassroots, local level governance. That is our street and community level. Remember this, we have a very strong local grassroots level of governance. Our street and community governance has also paid a lot to this fighting, because we all know that there are some kind of test stations, there are some kind of inspections and some quarantines, which are also under the leadership of the grassroots level. And finally, the third point is the healthcare system. As we all know, the test and the treatment of the coronavirus in China are all free of charge, with the finance budget support and the healthcare insurance and the healthcare assistance. That is to say, the test, the treatment, all the expenses of our fighting against coronavirus are free of charge, which is unbelievable in other countries, as we all know. So I think 3 points that I want to make. The strong leadership of our central government and the strong leadership of our grassroots level and finally the healthcare system.
Professor Hu Naijun will be getting back to you on this. While fighting its own tough battle against the outbreak, China has also been cooperating with the rest of the world, providing help to 120 countries and 4 key organizations. China has also sent several teams of medical experts abroad, including Italy, Serbia, and Cambodia. The country has shared experience in fighting the outbreak. It has published plans in diagnosis and treatment and in prevention and control online, open to all the world. The country has also established an online knowledge base and an expert database for international cooperation. Chinese experts have spoken to their counterparts in more than 100 countries and regions through 40 video conferences. China has also shared its scientific findings, including the first completed genome sequence of the COVID-19 virus. The best weapon against the COVID-19 may lie in a combination of treatments and therapies. It's knowledge that Chinese doctors continue to share with global peers. Sun Tianyuan reports.
Traditional Chinese medicine practitioners continue sharing their experience in dealing with the COVID-19 outbreak, a move welcomed by the global peers.
I think it's very fruitful for the entire world, because the pandemic has shaken the world, and so any treatment on earth is welcome. I'm very delighted to hear about the TCM and the treatment which the Chinese have introduced.
Chinese medical experts say so far there isn't any medicine available targeting the virus specifically. However, integrated treatment methods using TCM and Western therapies have proven effective. And as a forerunner, China has bought both time and precious experience for the world in the global battle against COVID-19.
We are introducing the Chinese experience as a reference for the world. They might even use our medicines to treat their patients. With our experience, we hope to help the world curb the pandemic as soon as possible. This can be a very good contribution to all of humanity.
Dr. Liu says the combo of ancient Chinese wisdom and modern technologies can provide more answers and solutions to win this fight for humankind and the world. Sun Tianyuan, CGTN, Wuhan.
Well, Professor Hu, I think it's fair to say that it's not totally easy for China to fight its own battle against the COVID-19 outbreak while helping other countries and providing experiences and expertise to doctors all around the world. What do you make of China's efforts?
Well, first of all, I would like to say that we all know that China is sharing its experiences, knowledge, data with other countries, and the experiences, data, and knowledge were achieved through sacrifices. That is why today we make a national mourning to those martyrs and heroes. So I think this kind of openness to the world of sharing the basic information about the coronavirus is cherishable, which is very valuable. And secondly, we also see from the materials point of view, China have paid a lot to the world. We have sent personnel, doctors, nurses to the pandemic countries such as Italy or other countries. And we also donate a lot of goods and medical staffs without any kind of conditions to other countries. So that is why we say not only we control the coronavirus within China, we also help the world and people to fight against this coronavirus.
And Professor, while we're talking about this, actually the situations of this pandemic are worsening in many countries. So at this critical juncture of time, what do you make of the current global governance, especially the public health governance system all around the world? Do you think more international cooperation and mechanisms should be established?
Yes, through this kind of battle against coronavirus, we can say not a country alone or a region alone can face this coronavirus all by itself. We have to unite together to make sure that any kind of effective ways to be introduced to other countries, and any other country can learn the experience that other countries have gained through sacrifices. Right now, we all know that China have found out that some effective ways or measures to fight against the coronavirus. But we have to say that some countries are not doing the same things. We all know that there are different cultural, political, or economic background in different countries. We do respect the differences. But right now, we have to say the effective ways, effective measures must be learned by other countries. So we can say without any international cooperation, this kind of learning cannot be achieved. So that's why we should say the world organizations such as WHO, the UN, or other kind of world international organizations should play their role. And there are also some kind of platforms in which cooperations between different countries could be taking place.
Thank you very much, Professor Hu Naijun from the University of Chinese Academy of Sciences. You're watching The World Today on CGTN. Stay with us.